Nursing, in my view for a nursing is an art and science. It's an art that the way you deal with patients or people in particular, you use your art in communicating with them. You need the art of dealing, how you can understand them as a human being. We have patients that sometimes they don't talk to you. You have to identify their needs based on your assessment. If you are talented enough to identify what the need of that human being, even without saying, what is my problem? It's an art of interacting with people from different nationalities, different age groups, different backgrounds, different diseases, but at the same time, each of them is a unique, and we have to respect their uniqueness while we are giving the care. I like nursing because the art of dealing with a human being, you can easily gain the reward. It's instantly. The satisfaction that you gain from people that you care for, you can easily find it with their appreciation for that care. Nursing is a science. It's never stable. There is advancement in technology, new things coming. Even our patients, we see patients come and go, different faces in a very rapid tone. So it's a very changing, it's not stable. We come up with the new modalities of treatment. We come up with the new treatments, with new challenges and new diseases. So you never feel bored, but also constantly you are challenged with the new things that evolve in the community. That's why my perspective on nursing, it's a career that involves a lot of caring, a lot of interaction with the humans, and at the same time you are using your knowledge and the skills in dealing with those people.
I'm Mrs. Deepa Thomas. I'm a lecturer in the College of Nursing, and also I'm the head of the department for the BSN program. Our BSN program, actually, it is a well-prepared program. It prepares the graduate to be a professional nurse at the international level. So this program meets the standard for an international BSN degree program. And we have included the nursing courses, nursing theoretical knowledge. We have included the general courses. We have included biomedical sciences. We have included social sciences like sociology, computer, introduction to computer or computer courses. So we provide the students with all sorts of knowledge needed to function as a nurse. And also we provide them with the theoretical knowledge, the practical knowledge, and clinical experience to gain the knowledge. As a student, you have to gain both theoretical knowledge and the practical skill and clinical experience. All are equally important. You cannot say which is more important, which is less important. For example, you cannot say your brain or your hand which is more important for you. Each one is important. Maybe people think the brain is controlling everything and brain is important, but if you lose your hands, how it would be? The same way. So the knowledge as well as the practical experience or the clinical experience, both are equally important. You have the general courses to start with, like chemistry, mathematics, microbiology, sociology, Islamic culture, introduction to computer. All these are the general courses you are studying, along with the English. English language proficiency is very important for a communication, for reading, understanding the textbooks. And then you will gain nursing knowledge, nursing courses like introduction to nursing, where you learn about the nursing as a profession, the theories of nursing, and the basic requirements to be a good nurse, like you learn the critical thinking skills, or how to apply the critical thinking, the problem solving, decision making, communication, a nursing process. All this in the introduction to nursing course you will study. Then you have the foundations of nursing practice. Again, it is a nursing course where the skill components are incorporated, the basic procedures of nursing. You will learn the procedures, you will practice it in your clinical area and in the lab also. And you have then progressing to the adult health nursing, theory and clinical. Now from the third year onwards, your nursing courses will separate the theory and clinical component. So the lab and clinical are one course and the theory is separate. You have adult health nursing, where you learn about different disease conditions and dealing with people with the different diseases. After that, you will progress to the next semester or next level, where you will, the course is family health nursing. You will learn to care for a family. So a pregnant woman, a mother and a baby together, managing the process of labor, care for the newborns, then care for the children. All this you will study in this course. You will progress to the year 4, first semester. You study community mental health nursing. Again, it's more specialization. Mental health component, you will study about the psychiatric illnesses, care of people with psychiatric problems. And the community health. Community health, actually it is integrating everything you have studied from your previous levels. How to care for individuals, families, and then as a community as a whole. When you want to provide health care for a community, you have to deal with individuals, with the families, and everything you have to apply. And also in this level you will study nursing research. So you will learn what is research, what is the importance of research, how to plan for a research, how to do or implement a research, the steps in the research process. And also you learn why the research is important and how to utilize, actually at your level, the BSN program level, this is the most important thing. You have to learn how to use the research, the knowledge, new knowledge generated, how to use to practice in your profession. Then the final semester, you have complex health alterations, where you learn about the critically ill patients and more advanced procedures in an ICU setup or in the emergency department, like in a casualty, so the emergency situations to manage. All these schools, the theory as well as the clinical, you will learn it. This is about the nursing courses. Also you have biomedical courses, anatomy, physiology, pathophysiology, pharmacology, nutrition. Then you have the general courses, as I told you, physics, the chemistry, mathematics, microbiology, Islamic culture, sociology, computer, all this. This is the different type of courses you will study, or the knowledge you will gain. For a nurse, the clinical experience, the clinical skills are very important. It's like you will practice in the, you will learn the theory part of the procedure in the lab, and then you will practice the skill in the lab, and in the clinical area you will practice those skills. This is for the skills to gain. But in addition to that, your theoretical knowledge also, what you learn in your theory, you see in your clinical area. You study about a disease, you see a patient with that disease condition, so you will understand what are the signs and symptoms or assessment findings in this client. You talk with the patient, you make the assessment of the patient. So you are not only gaining the skill, also you will understand about the condition in detail. You read the file, you see the management, what investigations have done for this patient, what medications the doctor is prescribing, what is the line of medical management. So you learn about the management of this condition. And you write the nursing care plan for this particular condition, for this particular client. So you will develop your problem solving skills, your nursing ability to write develop the nursing care plans, and you practice the nursing procedures. So you will your skills also will develop.
Okay, yeah, I'm Jocelyn. I'm Mrs. Jocelyn Bonuan Ferrer. I am a Filipino and I am teaching here in the College of Nursing right now. It's been my, this is my actually 5th year now in the College of Nursing. Okay, we have a lot of equipments and things which will facilitate the learning of the students, okay? We have different mannequins according to the skill or according to the body parts which the students want to examine or which the students need to see and learn from it, okay? Like we have mannequins in level 1, in level 2, in level 3. In level 1, assessment of the body. So we have different types of mannequins which they can use. Okay, for level 2, we have mainly what they do like IV insertion and everything. So they have those hands, okay, they have those hands with the fluid inside that when they heat and when they insert IV cannula, the fluid will backflow, okay? So they would know and they will learn from there how to insert the IV lines and everything. Okay, for level 3, we have, yeah, like this, a pregnant woman, okay, where they can see a baby inside. There is a baby inside the tummy of this mother, which we can open and they see. And they see how the mother gives birth, okay? So we just open, we just switch on the machine, okay, and it will bring the baby out, okay? So the whole mechanisms of labor they will see. Yeah, we give them a lot of activities or practices, especially IV insertions. Okay, because we cannot just do practice with the people in the area. So we have those mannequins, and they do a lot of that. Aside from the practice that they do here, they also do in the hospitals. The clinical instructors, especially from Amiri, and yeah, according to what the level 2 teachers were telling, they have very good feedback. The teachers allow them to do a lot of IV insertions from the mannequin, and they go to the patients when they see them already doing well with the mannequins.
I believe nursing is very important. When we started as junior doctors, nurses taught us even possibly more than doctors. We were really under their wing. They taught us everything about suturing, for example, and all the different equipments that they had under their care. We have tremendous respect for the nurses, and even going on to becoming a more senior doctor, going, for example, to things like the resuscitation room, the nurses there have more than 20 or 30 years experience. So they would tell us again the different procedures, and some of them are actually trained to do these procedures. So really they would guide us throughout these. So yeah, they tell us even down to the very small details. For example, there is an abnormal heart rate. Did you notice that? When I have more than 4 or 5 or sometimes up to 30 active patients under my care, but I have a nurse that's only in charge of 3 or 4. So obviously she's going to see the more fine details, and if she's worried, that makes me very worried. So absolutely hats off to all nurses. I would arguably say the role of the nurse is maybe at times more important than the role of the doctor. If you can see in triage, this is solely run by nurses. So how can they triage the patient and where do they go, which side of the department is all dependent on nursing. Also, if you can see at the front desk, the reception, that this reception, it's all judging by the nurse's experience. If she sees someone and she thinks that this patient is very sick, they go to wherever she believes is more important. So she can take them to the resuscitation room, she can take them for observation, or she can tell them to wait for the offices and for their turn. The role of the nurse differs a lot depending on which area she's covering or he's covering. If he was, for example, covering the minor operating room, then they would be more sterile, it's more of a closed system, and they would really be in charge of the equipment, the medication, that sort of thing. So it all depends their role on which area do they cover.
Or an ER room, or an operation room. To what extent does the nurse have a say in this situation?
To be a part of a team, you have to listen. We do not go with junior or senior, doctor or nurse. We all are together. Sometimes you'll find it's not just doctor or nurse. It could be, for example, a physiotherapist, a pharmacist, clinical pharmacist, and we all take the input together. We sit down and discuss the patient's management together. This is best not only for the patient, but also for the team members. When I listen to your concerns, maybe you do have an important concern. If you listen to my concern, also, there'll be something important being said. So if we work together, we actually get for better patient care.
What is the most challenging situation you might have as nurses?
Depends where. I think maybe the most challenging part of any healthcare professional in the ER would definitely be the abusive or the violent patients. So we do have protocols how we can save or protect each other when we have a violent patient, but this is a very unpredictable thing. Now I know, for example, in the ER we're not as bad as, for example, other places such as the mental health hospital, which really are suffering from this. But you'll always find, once maybe every 6 months, where a patient is, for example, or a patient relative is upset that they heard, like, for example, somebody died or something like that, and they start abusing, whether it's a doctor or a nurse in front of them, but they start becoming violent, they could shout, they could even hit. And this is an area that we really try and take very seriously. We have protection for this.
I like ER because there I will meet new people and new cases, also to learn new procedure. In CCU, there I will focus for only one patient and see his progress, and also I will learn how to read ECG, which is electrocardiogram, which is not everyone can read it.